My name is Jesse Clanton. I'm a liver and pancreas surgeon here at Prisma Health in the Midlands. I came to Prisma Health a little over a year ago, and I'm the first specialized liver and pancreas surgeon in the Columbia area. Liver and pancreas cancer have always been and continue to be in many ways very challenging cancers to treat. The first time I was introduced to Peggy was actually virtually through one of our GI cancer conferences.
Hi there, I'm Peggy Meyer. I've lived in Irmo for 37 years and I'm 69 years old and retired. I was sick every month, so I finally just went to the emergency room and tried to find out what was going on because my side was hurting at the same time. I thought maybe I had a infected appendix or something. And they said they couldn't find anything wrong with my appendix area, but they did see 2 spots on my liver, but I didn't think that was really important. Everybody's different, everybody looks different. I just thought it was kind of normal. That's also when they found out that my intestine had gotten tangled up from them tumors being there. That's why my side hurt. Otherwise, I would have never knew I had cancer. I didn't feel nothing except that side hurting there.
Peggy has something called a neuroendocrine tumor, which is a rare type of tumor that in many cases is slow growing, but in her case had actually spread from one area of her body to another, metastasized to her liver. I'd say that we realized early on that in order to provide these surgeries and this type of care to the patients, that we had several equipment needs. The first one is called the Thompson retractor system, which is a set of retractors that allows us to get the exposure and visualize the organs such as the liver and the pancreas, which sometimes can be very challenging to get access to and to operate on. But with this retractor system, we can do that in a safer, quicker, more effective way. Another piece of equipment is the BK ultrasound machine. It's an ultrasound machine that doesn't go on the skin, but we actually use during surgery, and we can place directly on a patient's organs like the liver or the pancreas. It can sometimes even help us find cancers that we hadn't seen from any of the other imaging, such as a CAT scan or an MRI that had been done before surgery. And then finally, the last piece of equipment we were able to purchase through these generous funds were the New Wave microwave ablation system. And that's a system where instead of cutting a tumor out, we place a probe into the tumor, and the probe heats up and ablates and kills the cancer cells. And this allows us to treat cancer in a way that's more minimally invasive, and a way where we don't have to cause as much harm by actually removing a part of the organ. In some cases, for patients who otherwise wouldn't be a candidate for surgery, this provides another option where prior to this they didn't have any options, and now we have a safe and effective way to treat their cancer. We approached the Prisma Health Midlands Foundation with these needs, and the foundation was able to provide $290,000. This helped us pay for multiple pieces of equipment that have proved essential to performing these surgeries. Many times, if you approach a hospital with equipment needs, it will take months or years sometimes to get what you need to provide care to patients. But because of the already built-in fundraising capacities through the Atrium Society and the Calvary, they were able to work with us quickly, and within several months we had this equipment here and we were using it on patients to provide these services and perform these surgeries.
Well, there was a team of doctors that all got together and they decided that I should have just one big surgery by Dr. Jesse Clanton, and that seemed like the best option as opposed to having several surgery in a weakened state. And then I found out later that they had purchased a whole bunch of equipment, $290,000, and that was supplied by the Prisma Health Midland Foundation. Otherwise I would have had to go to Georgia or North Carolina. And then I was just like shocked, that they had bought so much equipment and these people had donated so much money for things like that, it's just a wonder people, can be so thoughtful. So and giving to others. So I'm looking forward to the spring, and it's just a blessing to be able to see everything come to life again.
Before we had this equipment in Colombia, a patient such as Peggy might have had to travel hours away to go to another medical center in order to get her care. Not only does that, put a financial burden on many patients, but to receive that specialized cancer care away from your support system, away from your loved ones, your family members, your friends, that affects outcomes. And I personally just want to say thank you to members of the Atrium Society. Thank you to members of the Cavalry, the Young Donor Society, for being so generous and making this possible.